Thanks everyone for joining us for this session. The title of our session is Inclusive Multisectoral Approach Leads to Family Planning Results, and we're going to talk about the work of the FP Committee. My name is Laura Hurley, and I'm a Senior Technical Advisor for Family Planning, and I'm the Country Activity Manager for Madagascar.
Okay, my name is Paul Richard Irina. I'm the Country Director of HTP Plus Madagascar. Thank you.
I would like to start with a question. So could you please type into the chat what groups you think should be involved in family planning work at the national level? Annika's typing the question in the chat. Youth. Thanks, Georgie. Does anyone else have ideas for what groups should be involved in family planning at the national level? Legislators. True. Youth, legislators, civil society. Great, thanks. That's a good start. So this slide shows some of the groups that we engaged in the Family Planning Committee in Madagascar. The innovation of the Madagascar Family Planning Committee is that it is a true multisectoral approach and it is inclusive. In 2015, the government of Madagascar made a commitment to FP 2020. These commitments required engagement of stakeholders across sectors to ensure policy change, strategy development and implementation, and investment. An obstacle to any progress in family planning in Madagascar was the outdated RHFP law, which was written in 1920, and it limited information and services to family planning for women to married women with spousal support. The desire to change this law was an entry point for the Ministry of Population and the Ministry of Youth and Sport, as it falls within their mandate to protect the rights of women and young people, respectively. After addressing this first obstacle, the Family Planning Committee was solidified under the Ministry of Public Health at the Directorate of Family Health, with committed representatives of the Ministry of Population, the Ministry of Youth and Sport, donors, partners, civil society, youth associations, and the private sector. The Ministry of Economy and Finance was engaged to a lesser extent, but since it is responsible for the government's roadmap to attain the demographic dividend, their knowledge of the importance of family planning led them to engage in the committee regularly. So from 2016 to 2022, HP Plus supported the Madagascar Family Planning Committee in policy change, strategy development and implementation, and advocacy for investment. The FP Committee revised the old RHFP law and submitted a new RHFP bill to the National Assembly. HP Plus then built the capacity of the Madagascar Family Planning Committee, youth associations, and the 7 ministries linked to promoting the demographic dividend by providing training and supervision in advocacy using the AFP SMART approach. The training helped keep a multisectoral group engaged in family planning. HP Plus then supported their advocacy for passing the RHFP law using both health-related arguments and demographic dividend projections to convince parliamentarians with different priorities. HP Plus worked with the FP Committee to develop the CIP for family planning, keeping the Ministries of Population and Youth and Sport engaged. Using data from the 2019 Cost and Implementation Plan financial gap analysis and legal texts on essential medicines, the FP Committee was able to advocate to the Minister of Health and then the Minister of Finance for tax exemption of contraceptives. Also using this data and data from the FP Committee's CIP performance monitoring dashboard, the committee advocated for additional investment in the CIP to government, partners, and donors. Likewise, the FP Committee worked together to monitor performance of the CIP, using the CIP performance dashboard to gather, analyze, and visualize family planning data, including data on the dissemination of the RHFP law from multisectoral actors.
Okay, regarding this timeline of key family planning successes in Madagascar, first, the 2016-2020 CIP for family planning was developed in 2016 and 2017. and adopted by the Health Minister in September 2017. Second, the new reproductive health family planning law passed at the National Assembly, the Senate, and was promulgated by the President in January 2018. The new law ensures access to family planning information and services, regardless of the age and marital status. Third, in December 2019, the Parliament of Madagascar adopted the 2020 initial financial law, integrating tax exemption for contraceptives. Four, the introduction of the online CIP dashboard further engaged this multisectoral group of partners in performance monitoring of the CIP, since they could enter their own data, review the data in real time, and create their graphs. Five, during an family planning roundtable in September 2021, the president of Madagascar committed to IFP 2030 with the goal of reaching 60% of MCPR. And six, the MCPR for women is in Union increased from 33% in 2012 to 43% in the preliminary DHS report that came out in November 2021. Ongoing successes, as shown at the middle of the slide, are increasing investments for family planning and capacity of the Ministry of Public Health. Following FP 2020 commitments and promulgation of the law, the government of Madagascar committed to doubling the FP line item budget annually, where it increased from baseline in both 2018 and 2019. It unfortunately fell to zero in 2020 due to COVID pandemic. Following advocacy using the CIP gap analysis, partners and donors increased their investment in CIP activities. Of particular note was the increase in coverage of demand creation activities from 34% to 79%. Finally, throughout the CIP execution, the capacity of the family planning service within the Family Health Directorate to coordinate the stakeholders, all stakeholders, was improved for strategy development, implementation, investment, and performance monitoring. Few of these results would have been possible without the inclusive multisectoral engagement at the Ministries of Population and Youth and Sport, who work hard to promote the interests of women and youth, and the Ministry of Economy and Finance engaged to fight for demographic dividend, as you said. Okay, thank you guys. Thank you so much.
So we're happy to take questions, or perhaps someone on the line would like to share your successes with multisectoral engagement. Does anyone have any lessons learned from multisectoral engagement that you'd like to share? Either in the chat or you can turn your microphone on. I'm sure some of you have experiences with multisectoral engagement based on the people on the line, or if you have questions for us. Yes, we can take questions on FP in Madagascar generally. Quels étaient les étapes dans ce processus qui était le plus difficile, le plus grand défi?
Can I talk in French?
Yes.
Yeah, I'm asking Laura to translate for me. Bon, les étapes les plus difficiles, à mon avis, les défis, c'est que comme c'est vraiment multisectoriel, et puis il y a plusieurs types de partenaires et de parties prenantes. Pour les partenaires et parties prenantes, je pense qu'il n'y a pas trop de problèmes. Mais c'est surtout au niveau du gouvernement que des fois, il y a beaucoup de changements institutionnels et les ministres changent. Des fois, même une partie, il n'y avait pas de ministre de la Justice qui a démissionné, par exemple. Mais on essaie de garder les techniciens surtout. Et donc, on doit faire multiples plaidoyers.
So there are various challenges, mostly because it is multisectoral. There are a lot of different priorities to take into consideration. But one of the biggest challenges is transition of government staff and the secretary generals and other levels. And so there's constant transition. And at one point, there wasn't even a minister of justice for quite a long time. So we have to focus on working with the technicians at lower levels in order to move forward. Frances said she had an example in Nigeria, multisectoral engagements on DRM for what is domestic resource mobilization for RMNCH, HIV, and TB. Do you want to talk about that, Frances? Hi, Frances.
Hey everyone. Yes, so in Nigeria, we mobilized domestic resource mobilization, what we call technical working groups for DRM, and it cut across ministries of health, finance, budgets, and economic planning, the parliamentarians, including at the state level and at the national level, civil society, private sector, healthcare facilities, PL HIV for HIV and TB, and then of course CSOs that work in those sectors as well. So it provided this avenue to bring all the stakeholders together to discuss the issues with this key disease problems, interventions, and how to better do it. Now, some of the things that came out of that was that realization that people in ministries of finance do not understand, the things that happen with health interventions. And then people from the health sector assumed that people from ministries of finance and parliament and other people should know that health is important. So they didn't realize they need to demonstrate to them about why they needed to invest more in health and speaking to them in a language they would understand. And then also through that process, people from the ministries of health also learned that they needed to be accountable for them to get additional resources for health. So people from ministries of finance thought that health was a black hole where they just keep making investments and they don't see anything out of it. So health sector learned how to be accountable to say that, okay, we've assessed this funds. This is what has happened. These are the number of people who can now access, maternal and child health services as a result of these funds that we've assessed and all of that. So, and then they also needed to learn how to make the multidimensional case for health to say, okay, this is how health impacts on the economy. This is how health helps political career of, say, politicians and people like that. And then the civil society and PL, HIV and all of that also got the evidence that they needed from the government agencies to use in budget advocacy, engage government, citizens representation and social accountability.
Great. Thank you. Thank you for sharing that. Thank you for joining us, and thanks for that example. We definitely had similar challenges and goals in Nigeria and Madagascar.